Now let's talk about vaccines, specifically mRNA vaccines, and the funding they are now set to lose. The U.S. government now getting out of that research for the very first time in 40 years. RFK Jr., the Health and Human Services Secretary, is canceling almost $500 million in research funding. Our Corin Hoggard is live in the newsroom. And Corin, what's the reasoning behind these cuts?
Well, Nathan, RFK says they're twofold. The vaccines are not very effective, he says, once viruses mutate, and the vaccines have safety issues. Now, vaccine experts told me he just doesn't seem to understand the science. Studies have actually shown the mRNA COVID vaccines developed during the first Trump administration saved more than 3 million American lives. They're very good at preventing infection of their targeted variant, and even after mutations, they're good at preventing serious illness and death, and serious complications actually do happen, but they're pretty uncommon.
It's got a good safety profile. There are rare myocarditis effects, far less than from the virus itself. But, for him to kill that technology when it may be our best hope for a new pandemic situation is very self-defeating for the country.
We're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines.
Now, Corin, he mentions whole virus vaccines there. That's what the original stock vaccine against the polio was, so it's really the reason we don't have polio anymore. Why don't vaccine experts think that's a worthwhile investment?
Yeah, whole virus vaccines use a weakened or deactivated piece of a virus to trigger an immune response, and some of them have been very successful, but they're also much harder and slower to produce, so they're not super useful in a fast-moving pandemic. And 2 whole virus vaccines are responsible for some of the worst adverse vaccine effects in American history back in the 60s and 70s. So basically, the experts say this has us looking backwards while other countries are actually moving forward with mRNA vaccines, which actually have recently been showing promise against even breast cancer and pancreatic cancer, Nathan.
Thanks, Corin, for that. We appreciate it.